Welcome back to Something Private, a podcast for Southeast Asian women by Southeast Asian women, exploring conversations around health, the self, community, and love. My name is Nicole, and I am your producer and host. Before we start off today's episode, I'd like to give a special shout out to our friends at the National University Heart Centre Singapore, or NUHCS for short, for teaming up with us on an episode on women's heart health. In light of March being the dedicated month for women, I'd like all of you ladies tuning in to think about yourselves for a minute, and for the men to think about all the women in your lives. There's this saying that us women, we often put ourselves last. We care for everybody in our vicinity, our family, our friends, our partners, but we often find it selfish to think about ourselves. Just think about it. Who in your family makes sure that everybody is cared for and fed? So I have two guests with me today who are the two women running one of Singapore's first gender-tailored healthcare program that's focused on women's heart health. So I'm wondering, doctors, before we begin with introduction, if let's say I suffer a heartbreak, could I come to you guys for help?
I think you're a bit too young for that.
But generally, I do think that if a person is experiencing stress, and especially for women or even a young lady, she can manifest with chest tightness, feeling congested in the chest. I mean, you already can feel heartache, but whether that actually means something organic, of course, is another different thing. So, but when we talk about broken heart syndrome in medical terms, stress-related cardiomyopathy or Takotsubo cardiomyopathy, we really mean it like a medical condition. But emotionally, when a woman feels like she has got a heartache, it doesn't mean that your heart is really getting injured at that point in time.
Okay, so doctors, actually we've been talking for quite a bit, but I've yet to introduce you guys.
My name is Ting, and this is Laureen with me. We are from the National University Heart Centre Singapore. We are cardiologists, which means we take care of matters of the heart, only real medical matters, not all matters. We are two of a bigger team who run the Women's Heart Health Program. We've got nurses and other female cardiologists with us. And why this program came about was because we find that we need to increase visibility of heart health in women and address this knowledge gap that women don't know that they can die from heart disease. So like among the three of us here, it's either you, me, or her who will eventually die of cardiovascular disease. It's 1 in 3 chance. We find that if you just label a condition for what it is, women are not picking up their ears and looking out for it, for their heart health. But when they say women's heart disease, women's heart health program, we're drawing the attention of women, the things that represents femininity. And that's basically the main aim of the program.
Several things that I want to unpack here. The first thing that really struck me was the idea of a gender-tailored healthcare program, right? I think I've never heard before, besides like maybe gynecology or like doctors who specialize in like men's health. But is there a similar program in other parts of the world, like specifically on a condition that affects both men and women, but are skewed towards like one particular gender? Essentially, is Singapore the first to do this?
Oh no, definitely there are other countries that have this, especially the Western counterparts, right? You know, they are more big on things like feminist movement, women's rights. So we're actually a little bit slower to the game. You know, we just want to label it, give somewhere where women can come to and really just get their hearts checked.
We definitely take care of men's heart too.
Okay, no discrimination. Okay, so the other question I have is, when I first heard about heart health, and I feel like I can speak for a lot of girls my age when I say that the term kind of flies over my head quite a bit, right? When I think about heart health, I'm like, oh, okay.
Nobody talks about looking at the inside and making sure that your heart is healthy.
But I think also when you're young, you just focus on things that are immediate. You know, you want like now immediate benefits. I do this, I go to the gym, then I look toned, you know. Whereas when it comes to heart health, you're talking about long-term investments and you're talking about things that you cannot see, and sometimes it may make you may have to do have some sacrifices because like maybe your friends smoke or less healthy behaviors, and you probably will also want to do it. So for you at that age, usually when you're young, it's just not something you even want to think about.
Yep.
So heart health is really a very big term, right? So usually when we say heart disease, there are many, many conditions. So it's anything that can affect the heart, which is like a pump, and then the blood vessels. So together, the vessels and the heart together is like a closed circuit. So it can range from things as simple as like high blood pressure, which can damage your vessels. If it's damage to the brain, you can get things like stroke. If it's damage to your heart, then you can get things like heart attacks. So it's really a big range. But I think generally when you talk like in terms of media or when people are discussing, when they say heart, I think people are thinking about heart attacks.
Yep.
Am I going to get this condition called coronary artery disease? So it means there's disease to the blood vessels specifically feeding the heart.
And I think what many women, actually or men as well, don't realize is that while cardiovascular disease is actually the top killer in the world, 80% of the time, the condition is actually preventable. And prevention doesn't start when the disease has, come on board. It starts before conditions appear. So it really means that we can take action from our youth. And women live longer, right? I don't have to care that much. And we want to change that notion for women.
I didn't know that heart disease is the number one killer of men and women.
You are like everybody else. You think that breast cancer is the one who kills you, right? That kills you?
Yeah, or a cervical cancer as well is a really popular one.
I don't know why the breast is always taking attention away from
I think it's
the women
because
and the men.
it signifies femininity. It's something like outward,
Yep,
your value, your worth.
Yep. It represents
Yeah.
what it means to be like a woman,
Exactly,
right?
exactly.
Yeah.
So I do feel that women associate themselves with the organs that represent femininity more because I guess it improves your self-esteem. Nobody wants to lose the breast. But the heart is on the inside. But it really goes a long way because women generally already live longer than men. And so if you are not taking care of your heart, you actually live with the burden of disease much longer. And it's very hard to say you want to look healthy and feel healthy if your heart is not in good shape. It's pretty common in the medical setting when we have to propose, say, an intervention or treatment for a woman with heart condition. One of the first things she will say is, I need to ask my husband first. Or I cannot do this because I have to take care of my grandchildren. Or this other whoever has another medical appointment. Everybody else has a medical appointment before their own. They can send their children for sports classes or their parents for physiotherapy, but they can't come for cardiac rehabilitation after a heart attack. So I have a lady she's not too old, she's 60 plus, with a severe form of heart condition that causes the right side of the heart to fail. And she actually needs to have expensive treatment, to help to prolong her lifespan. She's suffering from this condition called pulmonary arterial hypertension. And she came with her daughters and I offered that therapy to her. She was actually very adamant against accepting any more therapy for a heart condition because she feels that her life is not worth the cost of the medication. And I remember it was really very emotional for me because I almost had to hold back my tears in the clinic to remain professional. But she actually, her daughter was there to say that, Mommy, we can pay for this treatment. We have more than enough and we can go ahead. But she actually knelt down in front of her daughter and held her hand and said that, no, Mommy will not take your Medisave money for treatment. You leave it for your children's education. I don't have to live too many more years and I have everything that I have. And I think somehow, I think women do tend to do that. It's bittersweet that women do tend to put everybody else before themselves first, and they tend to be more self-sacrificial. They like to see themselves as a role of the provider in the family. And if their needs can go first, they will let their needs go out first.
And I'm wondering if this is one of the motivations behind specifically catering the heart health program to women, right? That we think about all the things that like nobody else thinks about, like who has eaten in the family, who washes the clothes, who cleans the house, how are the rest of the family members doing emotionally.
Is this a reflection of your inner self?
It's a reflection of looking at all the women in my life. Because think about my mom also, like all the emotional burdens that she bears, caring for my dad, caring for me, my sister, and stuff like that. And I'm like, okay, take a rest, Mom, take a rest. I'm worried for you.
The program really wants to reach out to women to advocate for themselves, for self-care. And the good thing about getting a woman educated about heart health is that if she knows how to have a good heart-healthy lifestyle, she will actually brings it for the entire family. So the impact is great. There is definitely a lot of literature that have been published about differences, biological differences between men and women, and gender differences when it comes to seeking healthcare. So, for example, even with heart attacks, women tend to present to the hospital later. They tend to live with their symptom longer before coming to the emergency department.
Yep.
And actually the sad part is by the time they come to the emergency department, there is a tendency that doctors tend to dismiss women more than men. And on top of that, there are actually some conditions that affect women more than men. So like stress-related cardiomyopathy is one of them, as we mentioned earlier. But there are some coronary syndromes that affect women more, like spontaneous coronary artery dissection, microvascular angina. So these are medical terms. I think I won't dwell too much into it. But even things like heart failure, a certain heart condition can affect women more, such as heart failure with preserved ejection fraction. And we see a lot of them in the hospital. But women are just not aware that if they feel short of breath, or if they feel any chest tightness, they should come to the hospital and get it addressed early, rather than try to live with it or find excuses around it. Take care of everybody else with the problem first.
Seems to me like there are two things here. The first thing is that women are not coming forward to seek help when they are experiencing certain conditions. And the second is, like you mentioned just now, that women are turned away from doctors, or like their pain is downplayed. I'm wondering what's the reason for these two things.
I'm hoping they are not getting turned away already.
Yeah, I think it's a lot better. I mean, firstly, to answer the first part, so if for women themselves, if you're not even aware, the concept of getting a heart attack or having a heart disease is not even in your head, you're less likely to come forth and seek treatment. And it's really, really pretty common, to be honest, that I have this lady who's like maybe 50 or 60 years old, and then we tell her, oh, look, you have underlying heart disease. Maybe it got picked up on a stress test, or maybe after a heart attack. And then usually after that, they will always say, like, how can it be? I'm always well before that. I didn't have anything before that. That's why we were saying you need to really start from when you're young, because all these disease processes might have started when you're 20 or you're 30 and 40, and it just gradually worsens. And the other reason for us having this gender-tailored program is there are other specific risk factors in women, which you don't see in men. Like, let's say if you have gestational diabetes, that means your sugars were high during pregnancy. That itself is also a risk factor, which most people think, nothing much about it. They say it just disappears after pregnancy, and after that I'm just so busy taking care of the kids, it just gets forgotten.
Absolutely.
So I think really it's the education and awareness part that's why women are not coming forth. And then secondly, women these days are really, really very busy, like we're all juggling careers, you have family, it's just too many things. And then that part of their heart health just simply gets forgotten.
The heart is the last thing that they think about.
Exactly. You don't see it, so out of sight, out of mind, that kind of thing. And then when it comes to doctors turning away, makes us sound really bad.
Not at all.
Yeah, but I'll say a lot of times it's just human nature to be quite quick to judge. I'll share something personal, like even myself, even though I'm part of this women's heart health program, it's just something that's very, very subconscious. Like I had this patient who was very, very anxious. Before that, she's already been seeing a psychiatrist. She's got anxiety disorder, depression. She's struggling a bit with alcoholism, difficulty within her family. She's about 50 plus years old. And the referral letter was from a GP who also said that, I think this woman's it's just menopause, or she's just anxious, but since she keeps coming back, I think I'll just refer her to you. The context, and all this first impression you're getting is like, okay, this one sounds like
not
maybe,
a real problem.
Yeah, not a real problem, just anxiety. And then finally, when she came that day, she also looked absolutely anxious, the kind where the eyes just pacing all over the place. And she kept asking questions, and in between she was tearing. But I decided, since she really had all the previous a lot of blood tests and everything done at GP, I thought, okay, well, I'll just do a stress test for her. But in my head, I was thinking, this is going to be normal. And then 2 weeks later, she came back, and then turns out, the stress test, which is like a running test, turned out it was actually positive. So I was quite shocked. I mean, I'm glad I didn't write her off, but I was really guilty because inside, I was judging her as well.
Yep.
So it's really, really easy to just like, she's a woman, she's just being anxious, she's going through menopause, you can just write women off this.
Yep. It's very interesting, and I feel so sad
I definitely have been caught the same way, definitely.
Yeah.
I've done tests on women which I expect to be normal. In fact, I tell them that we'll just do the scan just to make sure, to give you a peace of mind, because she's grieving over a son's death. And she's feeling heartache like you described earlier. You know, like I have chest pain, I'm sad, I'm grieving, and I cannot sleep at night because the pains are disturbing me.
Yep.
So I was like, okay, that sounds completely a natural process with grieving, but yeah, she's got a little bit of risk factors. Okay, we'll just do a CT scan and make sure that the coronary arteries are clean. And she actually had very severe coronary artery disease, and it was the grief and the stress reaction that brought out chest pains, and it manifested for the first time. Just imagine it can be easily just,
Brushed off, right?
Because I think women generally tend to have more subtle symptoms
Compared to men?
compared to men.
Okay.
And I guess it does take a discerning doctor to want to address the problem at the root, like to decide that we better really screen for heart disease in this patient. So I think if that thought is not in the head, then for both the patients and the providers, then basically it can be missed.
So many interesting things. I think the first thing is, what are the differences then between like identifying heart disease in like men and women? If let's say women are being turned away more often than men, right? Then why are the men not being turned away?
I like to say that maybe in our institution, maybe with the program, maybe providers or the doctors are generally more aware that we shouldn't have any healthcare disparity in providing care between men and women.
Is it also because, just now, Dr. Laureen, you're mentioning that the patient that came in had menopausal symptoms, right? Is it because like it's more linked to like various aspects of like her body? That's why it could be like mistaken for like another condition, or like you guys, the doctor might not recognize that.
So menopause, one of the classic symptoms is hot flushes.
Yep.
So that's where, the patient usually would describe, I feel my heartbeat beating very fast. There's this hot sensation coming up my chest.
Yep.
So that always frequently gets mistaken, vice versa. It can be either way. Menopause symptoms get mistaken for heart condition, and heart condition get mistaken for menopause.
Or maybe it's also the way the women present themselves when they come. They come in with, they're not coming in to say that, I think I have heart disease, can you check my heart? They come in saying like, I have seen other doctors and they say it's not the heart, but anyway, I agree that I'm stressed, I agree that I'm depressed, I think it's not the heart, but I just thought I'd come and see you just in case. And
That's true, that's the usual way. They say, I think it's actually gastric. Sometimes when I take the gastric pill, it helps. They kind of trying to convince themselves and ask that it's not the heart.
So now I'm just getting a bit scared and worried because I'm thinking about my mom who tells me the same things like hot flushes, a bit of like depression as well, gastric. So okay, I'm going to check my mom if she's okay. I'm wondering if you can share a bit more also about like the aspects of like, it seems like there's a bit of a link between psychological and mental well-being and health as well, because I think you guys were sharing that some of the women that come in have like anxiety, have like depression. So is there like a link between these two conditions?
Yeah, definitely there's a link, but it's not directly, you can't say, I'm stressed and then stress therefore caused my heart attack. It's not as simple as that. And we do know that a lot of these emotions are normal. It's just part of being human, right? We have ups and downs, bad things happen, we feel grief. But if it's persistent, if it's chronic, if you're like in a chronic state of stress, long-term depression, never getting better, then it's more likely that you're going to make poor health choices. So let's say if you're very stressed, some people will be like stress eating. They will feel very fatigued and lethargic, don't want to exercise. Or maybe you might have insomnia. So all these things add up. And we do know like conditions where, let's say if you have a lot of stress and you're sleeping poorly, then you're more likely to get things like high blood pressure. And then high blood pressure increases your risk of getting heart disease. So there is a link, but I don't think we need to be too worried, when you're having stress for exam and then like, oh, am I going to get a heart attack? No, I think,
Yeah, but I think the association between stress and heart disease is definitely stronger in women than men. So for example, stress increases the risk of heart attacks 3.9 times more in women compared to 2.6 times more in men. So women are really just so much more vulnerable. So for example, when it comes to post-heart attack, women have a higher tendency of lapsing into depression compared to men. And that has been well established in many countries and across many studies.
Is there a reason for that?
I'm not sure whether it's just the biological sex differences that makes women more vulnerable. And there have also been studies and designed to see if stress are more likely to cause heart attacks in women.
Yep.
I don't think we have found like the link as strong as like smoking versus, leads to heart disease.
Yep.
But I think it's pretty clear that women are more vulnerable to the adverse outcomes of stress. And one of them includes poorer heart health.
Interesting. So what I'm getting is women are very vulnerable.
Take holidays.
We're taking a short break. Something Private is a podcast produced under media publisher Our Grandfather's Story. Watch our new episodes every alternate Tuesdays on YouTube and listen to us on Spotify, Apple and Google Podcast every alternate Thursdays. New episodes will be published first on YouTube and we'll be publishing once every 2 weeks this season. We've also just launched our new website, so pay us a visit at somethingprivate.fm if you'd like to share your story with us or work with us. Otherwise, you can send us a message on Instagram at somethingprivatepod or email us at nicole@somethingprivate.fm. We're immensely grateful for all the support you guys have given us, and we really couldn't have come this far without you. If you'd like to keep supporting our work, become our Patreon at patreon.com/somethingprivatepod. That's patreon.com/somethingprivatepod. Now back to the episode. I want to get down to finally talking about what are the symptoms of like cardiovascular disease so that the listeners who are tuning in can be like, oh, how do I identify, let's say, if I'm stressed versus like if I'm actually having like a heart attack?
I think the truth is that it can be quite hard to tell the difference. The most common ones that you know about heart attacks, you have a chest pain, TV show style, right? You clutch your chest. And then sometimes the guy looks like he's on the floor fainting, very breathless, cold sweat. So these are the typical symptoms, and usually men tend to have this more. Not saying that women don't experience this, they do. Women tend to have a lot of atypical symptoms. So atypical meaning it's just not as common. So it could be simply as feeling a heavy sensation or some heavy sensation in the chest or just feeling more tired. Some people will have things like what they say heartburn. That's why they think it's gastritis. So it's really, really not specific. I've even had patients who thought that their heart attack symptoms were actually due to a flu. It could also be something like you think maybe the patient's a very anxious kind of patient, so she thought, she's having a panic attack. There isn't really a clear cut like, yes and no, this is a symptom of heart disease or it's not. So I think the point is that if it's something different from your usual and you're worried enough, I think you should just come forth and get it checked.
Is there a difference between heart attack versus like panic attack, for instance?
Yeah, it's two different conditions.
And I guess
right?
like how does one recognize one of each?
Okay, well, they're actually very similar in terms of patients will always say, my heart is beating very fast, I'm having cold sweat, some people are hyperventilating, they cannot breathe. And you can have this chest pain, palpitations, they're essentially about the same. But I think context is very important. So if, let's say, you are young, you're going to have an exam, you are stressed, then it's more likely, okay, maybe it's just a panic attack, right? And then when you take a break, you calm down, it's fine. Versus, say, if maybe you have some risk factors, maybe you have a high blood pressure, you have some family history of someone having maybe a stroke or a heart disease, and then you suddenly get this, and you're not really facing any stress, then of course, you should be thinking more of a heart attack. These are two very extreme different examples. Of course, sometimes the lines can be blurry, like sort of the patient I said earlier about, she has both, right? So I think it's better to just get a baseline, find out your risk factors, get a check. I think there's nothing wrong with that, even though I guess some people might be a bit embarrassed to be like, actually maybe it's just anxiety or panic attack. But I think it's really, really the right move to, just come and get it checked.
We'll see a doctor if you're unsure. That's why we are there.
We're trying to look more friendly.
Smile at the camera.
Yeah. So I think it's important for the patients to be aware of their risk factors, because once you know your risk factors, if you feel any symptoms that may be suspicious, you know how soon you should really go see a doctor. And common risk factors, which most people will already know, will be hypertension, diabetes, and high cholesterol. Then again, these are conditions that maybe start usually from above 40 to 50 years, maybe for women even older compared to men. If you're a smoker, your risk is many times increased. If you're a diabetic in a young woman, as in before 30 and you're diabetic, your risk is many times higher as well. If you have a history of diabetes in pregnancy or hypertension in pregnancy, that will also increase your cardiovascular risk. Family history of coronary disease in somebody who's younger, somebody who's 50, in who had heart disease before 50 years old, that means that you have positive family history. And of course, we always say that if you are exercising and you have a good weight, then ideal weight, then you're less likely to have coronary artery disease or cardiovascular disease. So if you're on the obese side and you are not exercising regularly, then your risk is actually higher as well. So if we are actively addressing them and you recognize them, and if you have a symptom, you know when to see a doctor early, you're pretty much doing as much as you can.
So what I'm hearing is anything can be a risk factor, from the stuff that you eat, to your family history and background, to the amount of exercise that you have. Yeah, essentially to maintain a balanced lifestyle. Would that be correct to say?
Yeah, so I think to protect yourself from cardiovascular disease, you basically just need to have a lifestyle that is ideal in many ways. Have a balanced diet, have enough time for exercise,
rest,
make sure that your mental health is also good, which is the amazing thing about prevention for cardiovascular disease. So let's say if you want to prevent breast cancer, basically you do a mammogram, when your age, when you reach a certain age criteria, that's just that one step, pick it up early. But cardiovascular disease prevention is not like that. So you need to advocate for it right from the beginning and make sure it's incorporated into your lifestyle so it becomes just second nature. While chest tightness and shortness of breath is the most common presentation of heart attack or any like a beginning of coronary artery disease, for example, or even heart function disorder or heart failure, women do tend to have more subtler or atypical symptoms surrounding it, so much so that they don't feel the chest pain or shortness of breath is the predominant symptom. And it's just more easily brushed aside. The amazing thing about coronary disease is if you actually reduce your effort, the pain or the shortness of breath can actually go away. And I think that's what a lot of people try to do. I realized that if I do more work, it brings it up. It gives me that chest tightness and shortness of breath. And if I rest, it disappears. So I just do less. I don't climb 2 stories now. I climb 1 story. I feel okay. I don't, do that much of my heavy grocery shopping. I just get my family to carry it for me and I feel okay. So when you deliberately reduce your effort tolerance to make your symptoms better, then you are hiding the symptoms again. So I usually tell my patients that it's very important that you are as active as possible and you are really exercising every day, because when that is like a ballpark for your usual effort tolerance. I used to be able to, walk 2 rounds around the park, but now I'm catching my breath with 1 round and I'm getting, chest discomfort with 1 round. There's something wrong, it's not the same. So the answer to that is see a doctor, not, okay, I'll just keep to 1 round, or maybe half a round is even more comfortable. That's the main message we want to get across to the ladies. It's very easy for them to say, I've just been doing too much work. So I'll just, just take some time off.
How about for the younger women, for instance? Is there anything that we should be particularly looking out for? And maybe what are some common symptoms that maybe a 20-something, 30-something year old might experience? I'm assuming that you guys have patients that are that young as well, right?
So generally, the common cardiovascular disease that we talk about, they generally do affect women of an older age group than a younger age group, simply because it's a acquired disease that comes on with age and it is related to lifestyle. And compared to men, women do have cardiovascular disease a little bit older because pre-menopause, our female hormones are protective. God is fair to us in some ways. For the younger women, I would say that generally just having a healthy lifestyle goes a long way, not to be reckless in your youth, in what you indulge in. We also do pregnancy and heart disease in the program. And there are patients whereby the pregnancy is actually like a nature stress test for the heart. And sometimes some heart condition manifests for the first time when you're pregnant. Again, it can be quite hard to discern whether this chest discomfort or heartburn related symptom or shortness of breath is due to just a growing tummy. Or is it like a cardiac condition. So I think the main message is just to be aware that women are not spared from heart disease. So if you do feel discomfort in terms of tightness, non-specific chest pains or shortness of breath, see a doctor early. But otherwise, a heart-healthy lifestyle goes a long way. I think Laureen can elaborate what it means by a heart-healthy lifestyle.
So actually, it's quite simple. I think heart-healthy lifestyle is something we all learn in physical education, PE days, health education. I mean, we're taught from young, eat your vegetables, to run, exercise. But I think it's sort of like 1 year in, 1 year out, you know, you sort of, yeah, I know, but you just don't actually truly like understand the importance and realize how good exercise is. Exercise is actually really a form of medicine. Most of us rather, I don't know, I think quite usually when you're 30s, maybe you'll be a bit more conscious about your health. Some people will be often asking us like, oh, can I take this supplement, that supplement? What can I do to make my heart better or something like that? But exercise is way better than the supplement that you're trying to buy. There's so much evidence out there for exercise. So there are a lot of studies that have shown, long-term studies, definitely exercise prevents heart disease, that's clear. It decreases your risk of things like high blood pressure, diabetes, but beyond just heart disease alone, it also decreases links like with colon cancer or like dementia. So it's just so beneficial for your overall, all your organs and your overall well-being. And it's something that you should really start when you're younger. All this heart disease, heart attack, I know it's just too far away. Like sometimes you cannot imagine it's 50, 60, but I think you need to remember that the process is actually starting in you right now. So it really pays to start early. And usually once you get into a routine when you're younger, it's just so much easier to maintain. It's really hard to say, after 40 years of not exercising, suddenly I want to, go to the gym. It's just really tough.
I just want to flex a bit and say that like I feel very like consoled because I exercise regularly.
So that's the other thing. Sometimes, when I ask my patients, so do you exercise? And they're like, yes. So what do? I swing my hands 5 minutes in the morning. And how much do you walk? Oh, I can walk very far. I can shop the whole day. But it's not the same. So when we say exercise, like for cardiovascular fitness, we really mean good amount of moderate intensity activity for 150 minutes a week. So when we say moderate intensity activity, it means that you must do enough to make you feel like you are panting harder than usual and you can feel your heart rate racing. Many people don't realize that even if the people who are suffering from breast cancer are not dying from breast cancer, they are still dying from cardiovascular disease.
That's very interesting. Could you elaborate more? I don't understand.
Cardiovascular disease claims the lives of women many times more than breast cancer. 8 times more if I'm not wrong. According to the latest statistics. Simply because breast cancer is not as common as cardiovascular disease, number one. With early detection and treatment, you can actually treat the breast cancer, right? You can remove the affected breast. You cannot remove the heart when you have heart condition. You have to live with it. The thing that many women don't also realize is that the treatment that you have for breast cancer also can affect heart function and coronary disease. So if you start off not having good cardiac health, then you are already disadvantaged if you have breast cancer. Certain chemotherapy may not be first line for you. Women who already have heart conditions early on in life, they are already disadvantaged if they have breast cancer and need to receive breast cancer treatment. The other way around, if you have breast cancer first, you receive treatment for breast cancer. There's some treatment that can affect heart conditions. When you cure a woman of breast cancer and they are in remission, but the toxic effects on the heart can stay with them and the risk actually stays with them for life, for many years. If you want to take care of your breast, you must actually also take care of your heart first. With coming up with this program and campaigning for heart disease in women, we really want to send a strong message that we should really advocate for ourselves first. If you're a lady, take care of your hearts. And it is little stories like this that keeps us going and I think make me feel like we have to empower women to want to put themselves in front.
It's not just like a buzzword, right? Empowerment, it's literal.
And we are really doing a lot nowadays. Women nowadays do a lot more than before. They are really not just managing the household, but even managing the household alone and holding the skies up for everybody at any one time is not easy. The commonest person to neglect is themselves.
I think like I shared with you guys earlier, a lot of our listeners are young women like my age, between the ages of like 18 to 30 with mothers, right? I'm wondering if there's any words of advice that you want to impart to them and also the women in their lives. Yeah.
Well, I would like to remind everyone that, this heart condition, I know it sounds very serious and very bleak and something that you cannot even imagine, it's just too far away, but it's really within your control. It's simply about just having a balanced lifestyle, diet, your exercise. I know 150 minutes sounds insane, like I'm really so busy, when am I going to get this 150 minutes? But I think it's also okay to just start from somewhere. Maybe it could just be as simple as just reducing your sitting time in front of the computer. Just go for walks, a quick jog. It's about starting small and then building it into your life, making it sustainable.
Maybe the young women, I mean, I don't know, even among my friends, we're nudging each other now. Have you done your exercise for the day? More like, have you done your facial for the day? Kind of thing. And I think if we have this narrative that keeps on going among the young, that we shouldn't be reckless in our youth. We're not young and invincible. A heart-healthy lifestyle goes a long way. Then I think we should be moving in the right direction.
Thank you guys for being here and teaching all of us a bit more about heart health. I will go back and tell all my friends and bring my mom for a check.
Thank you for having us.
Thanks for tuning in to this week's episode of Something Private. Hope you guys have learned something new because I sure did. If you thought the pain of a broken heart was strictly an emotional response, think again. It could jolly well be a heart attack. In any case, our friends at NUHCS want to remind you that no amount of pain is too small to ignore, and you have a duty to firstly be equipped with knowledge on heart health so that you can help yourselves, and secondly, to help those around you as well, especially those of us in our 20s and 30s with parents going on their elderly years. For more information on heart health, please visit nuhcs.com.sg or follow the National University Heart Centre Singapore at NUHCS on their Facebook page and YouTube channel. Or schedule an appointment with your doctor.